Are you pregnant and you have migraine headaches? Today we're going to be talking about migraine headaches and pregnancy. This is a long topic. We'll be discussing several aspects of this topic, including the negative effect of migraine headaches on pregnancy. We're going to be talking what happens to migraine headaches during pregnancy. How do we treat migraine headaches during pregnancy? How do we prevent migraine headaches during pregnancy? And finally, what happens to migraine headaches and how do we treat them after delivery or postpartum? We begin with the first question. Does migraine headache have a negative effect on pregnancy? There are several studies that have been done and have suggested that yes, migraine headaches could have negative effect on pregnancy, including eclampsia, miscarriages, low birth weight, and including birth defect. However, these studies only suggested, did not prove 100% that migraine headaches have negative effect on pregnancy. So most likely, migraine headaches do not affect pregnancy negatively. Then the next question we ask is, what happens with migraine headaches during pregnancy? Now, we all know that migraine headaches are more common in females. Why? Because they are linked to hormones, in particular estrogen. Fluctuation in estrogen can aggravate and cause migraine headaches. That's why we have what we call menstrual migraine, which only occurs during menstruation. And also females who have migraine headaches, their headaches usually increase and worsen during menstrual period. So during the first trimester of a pregnancy, there's still fluctuation and instability of hormones, in particular estrogen, and therefore most likely migraine headaches they increase during the first trimester. Now, after the first trimester, then we have stabilization of the hormones, and therefore migraine headaches should improve after the first trimester. And 90% of the females will have improvement of migraine headaches after the first trimester. Next, we move to the question, how do we treat migraine headaches during pregnancy? That's a tough question, a tough task for a neurologist to deal with a pregnant female with migraine headaches because it limits what we can do, and a lot of medications that we use to treat migraine headaches, we cannot use it during pregnancy. So we begin with prophylactic therapy. None of the prophylactic therapy is safe during pregnancy, and we advise the minute the female knows that she is pregnant, she should stop the prophylactic therapy. None of it is safe. So we rely on abortive therapy, and we rely on ways to prevent and avoid triggers. So abortive therapy also, the classic medication that we use for abortive therapy to stop migraine headaches, which are the triptans. Unfortunately, we cannot use them during pregnancy because they're not safe. So we go to different medications. The safest medications is acetaminophen, Acamol, or Tylenol. This is considered safe. Unfortunately, it might not be very effective to treat migraine headaches. Then we move to the ibuprofen or the Trofen, and that medication should be safe during pregnancy. Naproxen should be safe, maybe less than ibuprofen, but it should be safe. And codeine also might be safe during pregnancy. Aspirin should be safe during pregnancy. Caffeine should be safe during pregnancy. So that's why we have some formulation where they combine acetaminophen or Acamol, Tylenol with aspirin and with caffeine, and that should be safe for pregnancy. But the key is to avoid the triptans. Now we move to the next question, which is essentially how do we prevent migraine? Because if we are effective in preventing migraine, then we treated migraine better than using the abortive therapy. And the way to treat it is to avoid the triggers. And we talked in a different video about the triggers for migraine, and there are many depending on the patient, and each patient has their own triggers. So some of the triggers for migraine headaches, including stress, including lack of sleep or sleep disturbances. Of course, some food, in particular garlic, baking powder, too much sugar, too much salt, all of those can be triggers. And the smell of smoke or smoking, all those are triggers. So we advise the pregnant female to avoid the triggers as much as possible. And at times it's difficult, especially sleep and stress, because pregnancy itself can interfere with sleep and can cause stress, that can be a trigger. But we try our best to avoid the triggers, and therefore the headaches will improve. We also ask the female to increase the fluid intake. Increasing fluid intake might help also to prevent migraines. Now we go to this question, what happens with migraine headaches after delivery, postpartum? Now, unfortunately, after delivery and during the postpartum period, especially from 3 days to 6 weeks, migraine headaches will increase in intensity and frequency. Reason? Because you have fluctuation of the hormones again. But at that point, depending on the patient, if the patient is not breastfeeding, so we go back to treating the patient as she is not pregnant. But if the patient is breastfeeding, we still have some limitations. So we can use prophylactic therapy now, and the only prophylactic therapy that could be safe for pregnancy or postpartum and for breastfeeding is propranolol. Propranolol should be safe to use, and that can be effective in preventing migraine. Then we go to abortive therapy. Sumatriptan or the triptans in general should be safe for breastfeeding, so we use them as abortive therapy. And then we use the medications that we use during pregnancy, including Tylenol, ibuprofen, naproxen, caffeine, or codeine, or aspirin. All those can also be effective and be safe for breastfeeding, but certain medications we cannot use. Also for prophylactic therapy, you might use Depakote or valproic acid. It might be also safe to prevent migraines. But at the bottom line, migraines are way different to treat during pregnancy, and they fluctuate. The most important thing I advise every female who is pregnant or plans to get pregnant is to stay connected and stay with the neurologist to plan the treatment and to be ready to treat the migraines if they increase during pregnancy, and especially after delivery. Thank you.